Good afternoon. Thank you for joining me today as I announce Bill 70, an Act respecting patient safety and quality assurance in this province. This bill is one of a kind in this country. While many provinces have elements of patient safety and quality assurance in their respective pieces of legislation, no other province has one comprehensive statute which contains all of the elements found in this bill. Patient safety refers to the reduction and mitigation of preventable harm in the healthcare system. Every day, healthcare providers work to provide the people of this province with the best possible care. Yet, despite best efforts and intentions, harm does occur. Our health system must ensure that should patients be harmed as a result of the care that was intended to help them, that they and their families are provided with information about what happened to them. Second, the public must be assured that the incident is appropriately reported and reviewed by healthcare administrators and clinical leaders. This legislation will also ensure that quality assurance activities are conducted in a consistent manner across the 4 health authorities and that healthcare providers can participate without obstruction. Specifically, the Patient Safety Act will ensure patients and families have access to information about their care. It will ensure that regional health authorities consistently report to the Minister of Health and Community Services on quality indicators such as hand washing. It will ensure that regional health authorities consistently conduct reviews when an incident occurs. It will establish regional and provincial structures to oversee and monitor quality assurance activities. It will protect healthcare providers who participate in quality assurance activities from reprisal, and it will address the recommendations of the report of the Commission of Inquiry on Hormone Receptor Testing, the Cameron Inquiry. With regard to Justice Margaret Cameron's report, this Act directly addresses recommendations for changes in the existing legislation, specifically in reference to the Evidence Act and Public Inquiries Act, to address any conflicts within them. The Act will allow any future commissions of inquiry to have access to peer review and quality assurance reports. It also addresses Justice Cameron's recommendation that legislation be enacted to entrench patients' rights respecting disclosure when harm occurs. There is no greater vulnerability that patients face as when in seeking healthcare a mistake, accident, error, or inadvertent harm occurs. Such events can be devastating for everyone involved. Patients and families live with the consequences, and healthcare providers live with the burden. Quality assurance activities are our key response. They lead to improved patient care, and they help reduce adverse health events through sharing of lessons learned. This is the ultimate goal of the Patient Safety Act. I'm looking forward to the debate on the legislation and its quick passage through the House of Assembly.